Hi, my name's Jill Tobin. I'm a registered nurse. I work in emergency rooms. I'm a traveling nurse. As terrible as this crisis has been, I love my coworkers, all of them, not just the doctors and nurses, everyone I've ever worked with. Custodial staff, I see you sweating in plastic gowns, cleaning floor to ceiling. That is life-saving work. It always has been, but it is especially now during the coronavirus. Healthcare workers are so badass. There's nothing like the feeling of having a really busy day and everyone just kicking ass and handling shit in a way that's efficient and safe and also compassionate. It's a really special skill. So throughout this crisis, I feel stuck between finding hope and strength in my coworkers and our ability to handle this moment, and simultaneously feeling just enraged and frustrated and betrayed by the systems around us that prevent us from doing that, from handling this well. And if you work in a hospital, you know what I mean about the systems around us. You know what it's like to be drowning in unsafe staffing ratios and have JACO come through and wipe their finger on the counter for dust. You know what it's like to have made impossible things happen all day and be, at the end of the day, feeling proud of yourself, and have your manager come through and ask you why you didn't update the date on the whiteboard. And in more recent times, you know what it's like to have scientific safety standards thrown out the window during a deadly pandemic. Some of us know what it's like to watch our coworkers die as a result of this. Reusing PPE is unscientific and dangerous, and we're just supposed to accept that it's normal and okay when it's not. So I'm making this video because all these things are connected. Like these benign questions from regulatory bodies, the constant policy changes, the PPE shortage now, all of it is part of a system that protects profit, saves face, protects hospital liability over patients and workers in human need. So as accustomed as we are to just dealing with what comes our way, what comes down from administration, we're very accustomed to just kind of putting our heads down and getting our work done. This is a historic moment, and we cannot be afraid to raise our voices. Our strength is in each other. There are way more of us than there are bosses and administrators, and we have to take care of each other because the system won't. So at Black Rose Rosa Negra, we support all workers coming together on this National Day of Action to demand something different, to demand people over profit, and to stand up for ourselves and our patients.
My name is Nicholas. I'm a nurse practitioner working as a primary care provider at a community health center, which are clinics that are funded by federal government, state authorities, various funding sources for the most exploited and oppressed communities. I think there's a few takeaways from the situation that need to be emphasized. One is, day to day, it's been real chaos. You don't see a lot of clarification from various authorities, regulating agencies, management, any of that. It's largely a situation of people fending for themselves, working together with colleagues, trying to find the best information out there, and improvising as you go, because the infrastructure simply doesn't exist in a fractured, profit-driven system. There's no basis for organizing things. The PPE just, it's the kind of scenario where you got a box of wipes or whatever it is, one mask, and you just don't know when you're ever going to get it again. So out of nowhere, you're having to kind of figure out what can we reuse, what can we do, how much can we actually clean. You need way more than you ever needed, and it's just not available. there's kind of a contradiction in the sense that things slowed down incredibly. Most people stayed home. The visits dropped, and clinics get paid by the visit. So the normal streams of funds that keep the doors open just aren't there. Workers are staying home. People are staying with their family members. People are getting sick. And because the system is based on pay per visit, it really locked things up. I've been a little lucky. There haven't been layoffs or anything like that, but many community health centers are being brought to almost closing their doors despite, getting small amounts of funding allocated by the government. I think, if you look at everything that's happening now, this was all predictable. This is not surprising. When private industries that dominate healthcare, like mostly equipment manufacturers, insurance companies, pharmaceuticals, the whole industry is organized around the needs of the investors pillaging the whole of society for those needs. And then you see that this is how things were meant to function. This is not an accident that things are occurring this way. The whole system has been structured to ensure that profit keeps going, even at the risk of lives in a crisis. I think the only way this will end is if healthcare workers come together and we fight and we put ourselves out there in the same way we do for our job, but for each other and for society as a whole. We have to organize ourselves as healthcare workers because we have not been as good as we could be. We need to be united. We need to be putting out alternatives and demanding what we know everyone needs. And when we're asked to put our lives on the line, I think, it's part of what we do. It's our job, but we should also recognize the power we have as workers to fight for these things and advocate. So, thanks.
Hello, I'm sharing this on behalf of a healthcare worker who is afraid of being identified by their hospital management. My name is Luz and I am a nurse assistant in South Florida. I currently work for a local hospital for over 3 years. I would like to share my experience as a healthcare worker during this pandemic. My workplace is neglecting its employees by refraining proper equipment when encountering patients with COVID-19. They made surgical masks and N95 masks inaccessible by storing them into offices of management and administration. Before the pandemic began, we were able to obtain supplies from the unit's hallway and even the clean storage rooms that employees have access to. Yet during March, all masks were gone and we were only given masks unless we have patients that are under contact precaution and tested positive for COVID-19. It was not until April that my workplace began to provide surgical masks to all employees who provide direct patient care. However, it was still held within management offices. When an employee is assigned patients who tested positive for COVID-19, they are given minimal protection. Our workplace only wants to provide one N95 mask, one goggle, one pair of shoe protectors, one head cap, and a pair of paper scrubs. These paper scrubs are initially used for Baker Act patients. The only supplies that were disposable were plastic gowns that are instructed to be worn on our back and front area. These gowns are also minimal and are restocked by management only. Many employees have tested positive, even including me, which is very traumatic and stressful. A few have been hospitalized and passed away within our workplace health system. Right now, we need to recognize the vulnerability and neglect of healthcare workers are facing during this health crisis. Our economic and political system is ignoring the hazardous conditions we are facing and are even profiting from our suffering. It is shameful to witness countless healthcare workers pressured to beg for supplies and even using home utilities like plastic bags to protect themselves. It is ironic and harmful to also call us heroes when none of us sign up to become soldiers. We are healthcare workers that want to save lives and not sacrifice our lives. Without healthcare workers, there will be no one to provide to our communities. Our current situation is revealing the corruption that exists within the healthcare system and social spheres. Health disparities, overpriced medical services and equipment, and inequality within our communities is not a novice topic, for it have been present historically for years. People of color, immigrants, and the working class are going to die during this pandemic. These communities face endless social ills due to racism, low socioeconomic status, food deserts, lack of healthcare access, and so much more. The emergence of a new respiratory illness is just a catalyst for the health inequality that are prevalent throughout our society. While politicians and elites continue to scheme this crisis, we really need to focus on helping each other and build mutual aid. This experience will provide us strengths and new ideas that could lead to our new era of resistance. The working class will become more willing to fight back and demand better conditions. We must pull our powers together to prevent this pandemic causing more harm to healthcare workers and to our communities.
My name is Morgan. I'm a medical dosimetrist in Los Angeles. I treat cancer patients at a private medical center. While healthcare workers are going through a serious health crisis with 787 confirmed COVID-19 cases here in LA alone, we're also facing an economic crisis, with hospitals rightfully urging non-coronavirus patients to stay home unless they need urgent treatment. Hospitals are facing a big loss of profit right now. And these hospitals are planning to weather the pandemic by passing the costs off onto the workers. So we're seeing thousands of healthcare workers across the country being laid off and furloughed right now. ER doctors are having their hours cut, leaving emergency rooms understaffed as they prepare for a surge in COVID-19 patients. My hospital has been cutting hours in every department. And so we began organizing around a petition to get the hospital to give us paid leave so that more vulnerable workers could stay home with pay. But I ended up being one of the first workers furloughed, meaning that I'm out of work in my hospital until the pandemic is over, sitting home without pay. Fortunately, I'm in the middle of packing my bags right now to move to another city to start the temporary job that I was lucky enough to get. But this just shows another senseless feature of our profit-driven healthcare system. While many nurses are working around the clock trying to save the lives of coronavirus patients, nurses from my department are sitting home without pay. We need a system that isn't based on thousands of private companies competing against each other to squeeze the most profit out of their workers. And we need to organize together to make it happen.
This crisis has made healthcare workers around the world realize that we need to stand up and speak out for a new system. Right now, thousands of people are dying and suffering, including hundreds of our colleagues, because of a system that prioritizes profit and competition over human needs and cooperation. We support the Healthcare Workers National Day of Action because the most important thing for us right now is to organize and fight. We know that the lack of PPE is real. We believe that factories need to be nationalized and converted into producing PPE and ventilators. We need to recognize medical equipment as a public good. Being able to quickly carry out massive amounts of testing will be critical in the coming months. We need to void patents that limit the sharing of life-saving knowledge and fight to maximize the production of testing mediums. We need to end international sanctions on countries like Iran and Venezuela so that they are able to access equipment and medicine they need. We need international collaboration and solidarity between healthcare workers around the world. Many people are staying home sick because they are worried about how they will pay for treatment. Millions of Americans have lost their healthcare coverage through layoffs. In the coming recession, we are going to watch patients die for senseless reasons, like not getting the cancer screening they needed after losing their health care. We need to fight for universal health care for all. Right now, winning Medicare for all is a real possibility if we build a strong movement for it, but we also need to be clear that this is only a baby step forward towards the kind of healthcare system we need. Like every crisis, this pandemic has exposed the inequalities created by racism and capitalism in this country. With Black people dying at a much higher rate than whites, we need governments to shift resources to Black, Brown, and Indigenous communities to combat the inequalities in healthcare system.
We need to address the wage inequalities within healthcare. Many of our staff make poverty wages, while risking their lives. All frontline workers are equally important, and we reject the hierarchical stratification of wages. We need a national $15 minimum wage with hazard pay, along with adequate sick leave for those who have to quarantine, and paid family medical leave for those who need to stay safe at home or take care of others. We hope you will join with us in fighting for these immediate emergency measures to fight the COVID-19 pandemic. We also know that we have been fighting since long before this crisis, and we will need to keep fighting long after. It is not enough to bandage the wounds of our wounded society. We need to cure the disease that is killing us and our planet. We need a revolution against the cancer of capitalism.
Although Medicare for All will save many lives, it is only the bare minimum that we need to survive. We will continue fighting for a healthcare system where patients are not pushed around by a dehumanizing bureaucracy and workers aren't exploited by 20 layers of healthcare administrators. We will keep fighting to create a healthcare system that is run democratically by workers and patients, and that treats people as full humans and not just a collection of symptoms. Taking the production and distribution of critical medical equipment out of the private market will also help us respond to future crises. But ultimately, we do not want the government or anyone as our boss, and in every workplace, we must keep fighting for worker self-management. This crisis has seen horrifying scenes of competition between countries as the U.S. hijacks PPE on its way to other countries, and as other countries desperately try to outbid each other for the dwindling supply of ventilators. When we emerge from lockdown, we may be at risk of reinfection from countries where the leadership is refusing to take science-based measures, like Bolsonaro in Brazil or Ortega in Nicaragua. We need to break down the rivalries and nationalism of the nation-state system and create a global community of solidarity without states, because we see now how the health of any one region affects the health of all of us. The need for an internationalist coordinated health system is clear. By building an independent grassroots movement of healthcare workers, we are building a movement that can keep going beyond this crisis to build a better world. We have power as workers, and we need to learn how to use it. Now or never. Don't give up your power to politicians or nonprofits to debate policy in the Capitol. If you are a manufacturing worker, you can use your power to walk out and demand that your factory be converted into manufacturing medical equipment like workers at GE did. The most important thing for frontline healthcare workers is to come together with your coworkers and fight for what you know is right. Fight to put people over profit. Like thousands of other healthcare workers have, you will discover your own power and that you can use your power to improve things for your patients and your coworkers. Whether you are unionized or not, create worker communities in your hospital to respond to issues directly as they come up. We know that this is a frightening and stressful time for healthcare workers, but we are seeing that we are not alone, and that we can use our power as workers to keep each other safe and keep our communities strong.